Greetings to you, all my students. This is for my third year batch of students. I hope all of you are fine and that all of you are at home, staying safe. So, this is a video just to try to make you recollect certain portions that we have already done in the class. So, certain things that you need to remember, and maybe it will help you to write your end semester exams, and also, it will aid you to do certain activities or tasks which I would like to give through Google Classroom. Okay, so today we will look at coronary heart disease, its prevalence, risk factors, and also some of the functional foods. I am sure that you remember most of the things that we have already spoken about this in class, but this is a long time back. So the first thing is that we must understand about the prevalence. Prevalence, we know that in India it is a very high prevalence. There are almost 54.5 million people who are affected with coronary heart disease. So it is a very serious disease or a condition, just like diabetes mellitus. And we already know that from all our previous studies that obesity, diabetes, hypertension, all these are linked to coronary heart disease. So as nutritionists, you must be well aware that the prevalence is high. Almost, nowadays you have the non-communicable diseases causing a problem in today's society. So you must be well aware of this fact. Now, coming to the risk factors. See, you can categorize risk factors into two types. Those which are modifiable, those which cannot be modifiable. Okay. Now, what do I mean by those which can be modified? Those which can be modified means that which we can take some measures or correction, either in the lifestyle, in your dietary habits, or it can be in your own personal habits. Okay. So in this, what are the risk factors, if I can say? What are the modifiable risk factors? One is, number one stays here is cigarette smoking. So coronary heart disease is a big problem, especially among smokers. So the prevalence is very high among smokers because it causes a lot of damage to their blood vessels, the endothelium especially, and it is definitely it is a damage to the lungs as well, because most of the time, most of the advertisements that we see focus only on the lungs, but eventually cigarette smoking damages your heart as well. So it damages your tissues gradually. So smokers have a very high incidence of coronary heart disease. The next thing, of course, is alcoholism. So alcoholism is linked to a lot of things, even liver problems. But yes, of course, there are many studies which tell you that drinking a little bit of wine a day is cardioprotective. But that is only if you get red wine, and again, if you have associated comorbidities, then it is not at all safe. So especially since people who have a habit of drinking alcohol may not be able to control it. So alcoholism as an addiction is very damaging for both men and women alike. The next risk factor we would say is having a very sedentary lifestyle, which is a problem which all of us face nowadays, especially during this period of a lockdown. And I'm sure all of you are at home, and you must be raring to go out. But still, the important fact here is doing some activity or the other, what you can do at your home level. So being inactive is a big danger for us, because man is not designed to be inactive, to be seated. We are designed to be on the move, use our arms, use our legs, use our muscles, and do activities, and to be physically fit. So if we were just meant to always lie down or sit, have the habit of sitting always, watching television, and doing nothing much by way of utilizing our body, then we would all be sick individuals. And this is what, on one side, what we are seeing today. So many people have realized this, and they go change their lifestyle by doing a very good planned exercise routine. So physical activity is something which is, lack of it is a big risk factor for coronary heart disease. And you would have already read about the benefits of exercise. Already you're doing sports nutrition, so I don't have to elaborate on that. And the more you keep yourself physically fit by an exercise routine, as in can be simple walking or doing your home exercises, which can be just doing some squats or skipping or whatever in your bedroom itself, can go a long way in changing the way you metabolize your nutrients, make your metabolism be boosted, and also to make you feel healthy and active throughout the day. So physical inactivity is a big danger for us. Now this physical inactivity leads to another big problem which we have, which is called obesity. Of course, we have done in detail on obesity, the diets which are good for obesity, not any of the fad diets, but of course a very healthy balanced diet. So obesity is known to cause dyslipidemia and a lot of other problems, especially in relation to your metabolism, and causing high LDL levels and high cholesterol levels. All this because of inactivity, and it leads to hormonal imbalance. So obesity is one reason, a risk factor. Another risk factor is diabetes mellitus. See, you can see how all this is linked. Physical inactivity leads to obesity, to diabetes, and of course hypertension, and thereby coronary heart disease. So it can be that you're having any one of these conditions, or your body metabolism by way itself is not very active. It might be dull. So in that case, you have to make sure that you're physically inactive. So beyond this, you also have certain other risk factors, like taking a very poor diet, especially a diet rich in saturated fats. So a diet rich in saturated fats is known to increase your cholesterol levels, increase your LDL and your triglyceride levels. So we must at all costs avoid a diet high in saturated fats, and of course a diet high in cholesterol levels. Now, as students, you're already aware that most of the organ meats are that which is very high in cholesterol content, and also the red meats. So anybody who wants to go for non-vegetarian food, it is always better to go for the white meats, the poultry, etc. Okay, coming to the vegetarian sources, you do not have cholesterol in any of the vegetarian sources. So you can be safe, assured, as long as you're taking, a lot of components like cheese or concentrated sources of fat, wherein you might get some saturated fats, then that is a risk factor in the long run. Okay, another component of fat which I would like to mention here is about trans fats. So do remember to write about trans fats, and we know that these trans fats are found in most of your bakery products where hydrogenated fats are used. And as students, you know that hydrogenated fats are nothing but your unsaturated fatty acids becoming saturated by the process of hydrogenation. So this process alters the isomer from the cis form, which is a natural form, to the trans form. So we have to avoid trans fatty acids because they are also proven to be atherogenic. There are organizations like FSSAI in our country who have started promoting the habit of eating healthy fats. So we must also be aware of this as nutritionists, and definitely make sure we don't include anything which contain hydrogenated fats. So please read the label. Okay, so our eating habits also have to be controlled. Then what else? Studies have found that taking inadequate amount of certain vitamins, as especially your folate, your B6 and B12, can lower a particular component, a particular type of amino acid called homocysteine. And this homocysteine elevated levels have been found to be really a marker, or a cardiogenic marker, or an atherogenic marker. The normal level should be around 15 micromoles per liter. But if you have elevated levels of this homocysteine, compound. That means there is a problem with your vitamin intake, and also it leads to abnormal lipid levels in your bloodstream. So this is also known as a marker. Another similar marker is lipoprotein A, which is also known to be an atherogenic component, and it is a part of apolipoprotein A. So this lipoprotein A levels are also checked out in the bloodstream. If the elevated levels are found, then definitely it is a risk factor for cardiovascular disease. These are all the blood parameters. Beyond that, physically, if your BMI is not adequate or not up to the level, what we call it as the normal level of BMI, which is 22 or 23, okay, if it's not as per the cutoff, and if you are not a sports person and you do not have big muscles, then definitely we can say that you can look at your BMI as an indicator of whether you are overweight or obese. Go by your waist circumference, go by your waist hip ratio, go by your skin fold thickness to know whether you are in the obese range. And especially for women, when it comes to obesity, another big problem is the incidence of polycystic ovarian disorders. Okay, so we find that one risk factor is linked to the other. And diabetes, even before you're diagnosed with diabetes mellitus, you can have the incidence of insulin resistance. And we've all studied about metabolic syndrome, which includes insulin resistance, hypertension, and a high waist hip ratio. So definitely you have to be thinking about insulin resistance, especially at a young age itself, if the person is an inactive or a sedentary person. So all these are little risk factors. Okay girls, so now we will go on to what are all the functional foods that can prevent coronary heart disease. There are many functional foods, many of it we are already aware. So the first category would be all your vitamins. Okay, so vitamins, especially those which have antioxidant benefits. So we have vitamin E, which you can get from your whole grains, vegetable oils, nuts, okay, dark green leafy vegetables. So what does vitamin E do? It protects your membrane against lipid oxidation. It prevents LDL oxidation. So it protects, it gives you a long-term benefit. The next is vitamin C. Vitamin C also is very essential. The best source of vitamin C is our Indian gooseberry, and of course we have oranges and all your citrus fruits. So these also protect, and they act along with vitamin E to give you a cardiovascular benefit. Followed by this we have beta carotene, okay, which is found in all your the dark yellow vegetables, okay. And after this we can move on to certain other nutrients, as in selenium. Selenium is also found in seafood as well as your millets and other wheat and whole grains, etc. So selenium is another thing which is needed for your glutathione peroxidase activity. So selenium is very essential. Sometimes we do take most of the nutrients, but we forget the role they play as in a functional food. Now, if you look at certain other components which we find, especially what we call as phytochemicals, which we find in plants or colored fruits and vegetables, as in you find it in grapes, or you find it even in beetroots, as in flavanols. So these are also cardioprotective. So eat a lot of colored fruits and vegetables, even your red onions, beetroot, etc. Now coming to another component which we find very useful, which is cardioprotective, is garlic. Now the Indian cuisine is very blessed. We use garlic. Most of the homes use garlic daily. So at least minimum 2 to 3 cloves of garlic definitely are used by the people in their cooking, day-to-day cooking. So garlic contains again cardioprotective component, prevents LDL oxidation. So garlic is an essential food which we have to use daily. Of course, garlic pearls are available in the extracted forms. That is, in the pharmacies they are available. But other than that, garlic in a daily usage itself will prevent your coronary heart disease to a large extent. Beyond this, we have fenugreek. Fenugreek has got a lot of soluble fiber. So among all the fiber-rich foods, we can call fenugreek is very useful. It is cardioprotective as well as it prevents diabetes mellitus also because of its mucilage and the certain other factors which are present in fenugreek. Followed by this, you have pectins which come from your other fruits and vegetables also, other fibers which are available, especially insoluble fiber from vegetables. All these, see, it is not that a single food can prevent coronary heart disease. All these together have a synergistic effect. What are the other components that we see in foods which are heart protective? A very important component is nuts. In nuts, we have especially the tree nuts, as in walnuts, almonds, pecans, etc. In this, if you look at almonds, they are very rich in vitamin E also. And the 70% of the fat in almonds is MUFA or monounsaturated fatty acids. So these are also known to lower your LDL cholesterol levels. And of course, vitamin E has an excellent effect in the form of lipid peroxidation, preventing it. So taking almonds, at least 4 or 5 almonds a day, is very cardioprotective. And it's also rich in magnesium and copper. Similarly, walnuts. So every day recommending a few nuts to anyone at home is definitely beneficial for you. Followed by this, we can use a lot of legumes. Every day we use dals. So legumes, especially all kinds of beans or pulses that we consume, do contain factors in them which are also heart protective. They also contain fiber, they also contain protein, they also contain minerals. So legumes are definitely needed in our daily diet. So if you look at it, the way I'm saying, I have right now I'm speaking about a balanced diet. So it starts with whole grain cereals. It starts with your pulses. It starts with your vegetables and fruits. So fruits and vegetables, at least 5 servings a day. And of course, we have to take dairy. Now dairy, especially yogurt, is found to lower cholesterol. So daily taking yogurt, but not with added sugar, is something very cardioprotective. Yogurt and milk have definitely, especially fermented milk, which is yogurt, has been found to act as a preventive in the form of for cholesterol biosynthesis. So yogurt is also considered as a functional food. So we have so many functional foods within our daily diet itself. Beyond that, we have a lot of good sources of fats which we find as in omega-3 fatty acids, like fish oil consumption. Especially taking fish 100 to 200 grams per week is found to be beneficial. And taking nuts daily is found to be beneficial. Taking fenugreek daily is found to be beneficial, at least 10 to 15 grams a day. Beyond these, if you can afford or if you can allow it or recommend it to the patient, if they can buy it, definitely flax seeds. A teaspoon of flax seeds are very beneficial every day. Taking sabja seeds in some form or the other, they are all rich in omega-3 fatty acids. So you find that even in our daily diet, we have a lot of functional foods which can be eaten without causing any harm to the body. But definitely, once you are diagnosed with a condition of a heart disease, these are not meant to be the only thing that you have to consume. You have to take the daily medicines. The medications are a must. If you are diagnosed to be a diabetic, if you are diagnosed to have any other heart condition, or any syndrome of metabolic syndrome or any of the conditions, you must advise the patient to take their daily medications. But apart from that, following this healthy diet will prevent a lot of things, a lot of degenerative diseases for the long run. So today we have seen, in one capsule, we have seen what are the risk factors of cardiovascular diseases, and in another capsule we have seen what are the different functional foods that we can recommend to the patients, okay, when they are having cardiovascular disease or when they are asking for a preventive diet. So the consumption of oil also should be to a minimum. I'm not dealing with the dietary management in detail, but you must know that we have to follow the AHA guidelines, okay, where we have the step 1 diet, step 2 diet, okay. All the details have already been shared with you during the class. So thank you girls for your patient listening, And I hope that all of you are fine once again. And good day to you all. Thank you very much.